Hi, welcome. Very good evening.
Good evening.
It's a pleasure that we are having a discussion which is very, very important for the women these days, and it's all about cervix cancer and what a woman should be knowing about cervix cancer. So, cervix cancer is most often diagnosed between the age group of 35 and 44. So cervix cancer often can be prevented by having a regular screening in terms of pap smear tests and the HPV, and to find out the pre-cancers and treat them on time. So with this regards, I'm sure there will be a lot of questions for women who are watching this, to understand what is this all about. So now to solve all these questions of yours, we have, Dr. P. Balasubramanian. So we welcome you. Yeah, your yes, sir, yes, sir. We welcome you, and it's an acclaimed. Dr. Balasubramanian. I would love to talk about him. So he's an acclaimed radiation oncologist who is having a 42 years experience, and that too, he's been into the teaching field for 32 years. And he's worked in medical colleges as a professor and a HOD of the department. So it's such an honor and privilege that I get to talk to him, and that we would get to understand about the cervix cancer. So he'll be able to enlighten us in a lot of areas which we might be having doubts. So presently, sir is a HOD in Tamil Nadu Government Hospital, multi-speciality hospital. And the beauty of him is that he uses an ionizing radiation, so such as mega voltage X-rays or radionuclides in the treatment of cancer. So, Dr. Balasubramanian sir's zeal to learn about the latest advancements in this and in the field of radiation oncology motivates him and to go to places to attend various conferences and workshops. So let's not wait and let's have a discussion. Sir, we welcome you.
Yes, okay. Good evening. Good evening.
Sir, so cervical cancer. We've been talking about various cancers, right now, but this is most of the younger generation that gets affected. The 35 to 44 is really a threatening age, when we talk about cervix cancer. So we'd like to know the cervical cancer, Abdina, and what is cervical cancer?
Cervical cancer, in the top 10 cancers in India, cervical cancer ranks among the two. Oh. First one is breast cancer, and second one is cancer cervix. Yeah. So it is you have to be very aware about this cancer. Right. After marriage, the ladies should be very aware, and they should undergo pap smear test to detect the cancer at an early stage. If detected early, it is completely curable.
Yeah. So that is what it is. So when it comes to the risk factors of this, so what are the risk factors of the cervical cancer?
Risk factors, mainly multiparity. Okay. Because of the multiparity, repeated trauma to the cervix and repeated infections, these are all the risk factors. And okay. Multiple partners, that is also one of the risk factors for cancer cervix. Mainly, it is related to the sexual thing.
Okay, agree. So doctor, as you suggest that it is about the multiple partners, it is about the more of the sexual thing, and it's about the infections that causes. So now how do we prevent it? That's the next important question, I'm sure.
Prevention is better than cure, everybody knows. So we should be aware, and we should have some medical examination. For the lay public, they should undergo medical examination by a lady gynecologist or lady doctor, and they should undergo periodic pap smear test, which is a simple test, taking fluid from the vaginal cavity and examining under the microscope to detect any change at the cellular level itself, so that we can detect the cancer cervix at a very early stage. So I am again telling, if detected early, it is completely curable.
Great. So that is lovely quote that you have told, doctor. So as you said, the clinical examination. So what is it that you mean by clinical examination?
Clinical examination means the lady doctor or a qualified doctor will examine the external genitalia and pervaginal examination of the cervix. They will examine under the visual examination, and they will do this Willy, they are telling, visual examination under Lugol's iodine, and they will do colposcopic examination or simple test. They will examine clinically the appearance of the cervix, and they will do digital examination of the cervix and see whether there is any ulcer, any induration, and the proliferative growth are there. They will detect at an early stage.
So as you said, the screening parameters that I would next like to know about. So in this, as you have discussed, now we are talking about the colposcopy, or you're talking about the pap smears, right? If I'm not wrong. Okay, so these are the tests. So what are the other screening options also available in cervical cancer? Can you please educate us on that?
Screening means only this examination of the external genitalia and the cervix, which is done by a doctor or a nursing person. They will do the clinically, only by clinical examination only it can be detected. Or the patient may have some symptoms like white discharge, which is an important symptom of cancer cervix.
Yeah, I was about to ask you about that.
Irregular bleeding PV, irregular bleeding per vaginum. Usually once in 28 days, as per physiology, the ladies will get this menses, menstrual period. Apart from this, in between the menstrual cycles, they develop bleeding per vaginum. That is an awareness, and that is a caution. If they get like that, they should do a checkup to see whether there is any abnormal in the cervix.
Okay. So as you said, now I was about to ask you that. So the signs and symptoms, as you said, would be the bleeding and the white discharge, right?
White discharge and sometimes pain also. Pain abdomen, back pain. These are all the basic symptoms of cancer cervix.
Okay, so that was nice, doctor. So now, having said this, so what are the preventive measures that you would suggest?
Preventive measures is like this only. We have to do checkup. If there is any abnormality, we have to do biopsy, and we have to do other investigations, and we have to take treatment. That is a preventive measure. We have to be examined by a doctor periodically. At least once in a year, they should be examined by a doctor to detect the disease.
Okay. So
prevention is only by examining, and if there is any abnormality, they go for treatment.
Okay. So நீங்க சொன்ன மாதிரி sir, as we sir has been insisting on prevention is better than cure. So இது prevent பண்ணனும் அப்படினா then regular screenings is must. So to summarize what sir சொன்னது என்னன்னா, so regular screening பண்ணனும். அதுக்கு உண்டான டெஸ்ட் கைனகாலஜிஸ்ட் கிட்ட போகும்போது நமக்கு வர symptoms பேஸ் பண்ணி என்னெல்லாம் டெஸ்ட் பண்ணி அதை ஸ்கிரீன் பண்ணி அது இனிஷியல் ஸ்டேஜஸ்ல இருந்தால் அதுக்கு என்ன பண்ணனும்ன்ற சஜஷன்ஸ் வந்து நம்ம ஸ்கிரீனிங்க்கு போனதா தெரியும். So that is what
mainly it is due to the infection.
Correct.
Main virus is human papilloma virus. It is called human papilloma virus. 16 and 18 that can be detected. That is only transmitted by the sexual contact. So we have to see whether there is any human papilloma virus in the fluid, vaginal fluid or cervical smear.
Okay. So that's a lovely way of explaining us about all this. So that is very interesting. So be careful. The screening that sir has been talking about ரொம்ப important. உங்க gynecologist கிட்ட periodic screenings கண்டிப்பா பண்ணியே ஆகணும். pap smear test இருக்கட்டும், HPV test இருக்கட்டும். So sir சொன்ன மாதிரி it's very very vital for women, especially இது curable cancer ன்னு இருக்கும்போது நம்ம வந்து இது ignorant-ஆ நம்ம விட வேண்டாம் அப்படின்றது it's a nice message that sir has given us. So how about the cervix cancer diagnosis, doctor? Can you educate me?
Mainly by pap smear. Next is biopsy. If there is any abnormal thing in the cervix, they will take biopsy.
Okay.
That is called punch biopsy. Taking a small tissue from the growth in the cervix, studying under the microscope by the pathologist. Pathologist role is very important.
Right.
They are called oncopathologists. They will study the slide and they detect the abnormal cells in the smear, and they will say which type of cancer they are having. Then only it is diagnosed as cancer. After that, lot of investigations has to be done, like CT scan, blood test, X-ray test, all these things to see whether it has gone from the cervix to any other parts of the body, so that we can plan treatment accordingly.
Okay, okay. So that's nice, doctor. So is there any grading and stages in cervical cancer?
Usually, all cancers are staged. Mainly, there are 4 stages in cancers.
Okay.
Cancer cervix also staged like that.
Okay.
Stage 1, stage 2, stage 3, stage 4.
Correct.
If it is only confined only to the cervix, it is stage 1. If
Okay.
it is extending into the vagina, it is stage 2. If it is extending adjacent structure from the vagina, it is stage 3. If it is extending to the bladder or rectum, adjacent parts,
Yes.
then it is stage 4. It is staged like that. Stage
Oh.
1 is completely curable. Stage 2, up to stage 3, we can expect cure. Stage 4 is only controllable and not curable.
புரியுது டாக்டர். So that was nice way of explaining. So இப்போ நம்ம stages பத்தி பேசும்போது, so stages, I mean first stage 1, 2, 3, 4 ன்னு பேசிருக்கோம். So what if cervix cancer வந்து spread ஆயிடுச்சு அப்படின்னா, then what are we going to do? What is it? What if it spreads?
It will spread to adjacent organs. Adjacent organs are mainly urinary bladder.
Correct.
And rectum. சிறுநீர் பை அல்லது மலக்குடல் இங்க ஸ்ப்ரெட் ஆயிடுச்சுன்னா it is stage 4.
Okay. Okay.
So we can treat with with radiation and chemotherapy for this patient. Okay. In some cases we can do surgery to remove all the parts affected. That is called externalization. We can remove the uterus, we can remove the bladder, we can remove the rectum, but they will have the disability of having a bag by the side of the abdomen for collection of this excreta.
Okay. Okay.
That is the one thing. We should not leave up to that stage. That is the main lesson for this cancer cervix.
That's right. So as it's very fearful to think
it is in the top 2 cancers. Right. People should get awareness about this disease. Exactly. Because we can cure this cancer, not like other cancer.
Yes. So
that is the point I am stressing here.
Exactly. So when you said it's curable, so what are the measures that we take to? Do we have any vaccinations per se, or
vaccination is there?
Okay.
It is under research, and it is not approved universally. Okay. There is research for HPV 16 and 18. There is vaccine which should be given for the woman above the 15 years of age, but it is not fully approved. Okay. And it is not in the standard of this vaccination. Right. Standard of care vaccination, it is not come into vogue. It is still under research.
Agreed. So, sir, when it comes to now, since if people are diagnosed with it, so what are the recent advances that we should know about the treatment in cervix cancer?
Recent advances, there are a lot of recent advances in surgery. We can do lap surgery also. Okay. Without opening the abdomen. We can do laparoscopy and remove the uterus. That is one advances. And in radiation, without having much side effect. Usually previously with cobalt, we have lot of side effects. Right. With the latest equipments like linear accelerator, we can give very less side effects. At the same time, we can give very high dose to the tumor in the cancer cervix, and we can get a high cure rate and good quality of life. And we are having another treatment modality like brachytherapy, in which case the radioactive source is inserted into the uterine cavity and give dose to the cervix. So that we can get a high cure, because we are giving high dose to the cervix without affecting the adjacent normal structures. So there are a lot of advances, and chemo is also come into vogue, and lot of chemo drugs are in the field, which can be used effectively in combination with radiation. That is called concurrent chemo radiation. So in combination with radiation, we can give chemotherapy, which will have a enhanced effect of radiation. At the same time, chemotherapy will have a separate effect on the cancer cells. So both will act separately as well as additive effect. We call it additive effect. It will add on to 1. So 1 plus 1, 2. So it will have good effect. At the same time, it enhances the effect of radiation, chemotherapy. So it will have good effect.
Okay, so that is a lovely message that you've given, doctor. So people, as doctor said, there are advancements, in terms of cervix cancer treatment, as sir told about brachytherapy, about lap surgeries, the varieties of, the various chemo drugs that have come into the industry that, that can definitely enhance the lifestyle of people. So don't get disheartened. First thing is prevention is better than cure. So always, we'll have to get into the screening mode and, ensure that we get screened regularly. But having said that, if you are diagnosed and if you feel, if you're diagnosed with the cervix cancer, then you don't lose hope. There are ways of treating it as well, as doctor said. So
definitely there is lot of hope. We can
yes.
treat it. Up to stage 1 and 2, we can give a complete cure. Even stage 3 also, there is some cure with this latest method of treatment.
So that's
Only
lovely,
stage
doctor.
4, we cannot cure, but we can give a good quality of life.
Right, that's lovely. So what is your key take-home message? What is that you'd like to convey to our viewers?
Main is awareness. விழிப்புணர்வு. இதை பற்றி விழிப்புணர்வு மக்களிடையே ஏற்பட வேண்டும். Awareness among the public. They should come forward for the pap test.
Yes.
But it is very difficult for the people to convince for the pap test. If you go to village, the village nurse will struggle hard to get a pap smear test done for the woman. They should have an awareness. If you do pap test and if you detect early, it is completely curable. Only they will have a myth that if detected cancer in the family will reject. That sort of myth they are having. It should be broken. Myth should be broken, and good counseling should be done among the public. It is actually mostly common in the lower socio-economic status. So we should reach the lower socio-economic people, and we should educate them, and we should create a good awareness about this simple test, so that we can detect early and have a good quality of life lifelong. They will have a good life.
Yes. So doctor, thank you so much for your time. So viewers, as doctor said, to summarize the whole conversation that we've been having about cervix cancer. So the regular pap smear test and HPV screening that needs to be done by your gynecologist. Please watch out for any signs and symptoms that you might be having a white discharge or excessive bleeding, or in an abnormal bleeding or something, or maybe a pain in your vaginal regions. And if you have any discomfort, please do talk to your gynecologist, because this is only way that we can eradicate this particular disease. So, and if people have to be screening, and we have to get over this disease, because it's definitely curable, as doctor said. So that's a lovely information the doctor has provided in terms of cervix cancer. So let's not wait. So people who are between 35 to 44, make sure you do this as a part of your life. You have to take care of yourself, because women are more prone to ignore your own health, and you are more for the family oriented things, and you get lost in your own work. But this is very, very important. So please do take care of yourselves. As we said, prevention is better than cure. So let's all strive to make sure we all live a healthy lives, right? So women of any age also can do the screening. It's not only between 35 to 44, but even beyond that also doesn't matter, right? So doctor, thank you so much for your time. It was a lovely conversation we had, and a lot of questions that you have answered us. Thank you again.
Thank you very much. Thank you.
Viewers, thank you so much. So have a great evening. Thank you.
Okay.